Hello everyone. We're here today to talk about managing your energy levels to reduce the impact of fatigue on daily living. It is very common for people with a palliative or long-term progressive condition to experience fatigue where they feel extremely tired, exhausted, or lacking in energy. Whilst it may not be possible to completely eliminate fatigue, it is possible to prevent and manage your fatigue to improve your quality of life, overall well-being, and independence. Let's pause for a few moments to think about your current daily routine. What do you need or want to do? What are your priorities? How does illness or tiredness impact on your daily activities?
The aim of this session is to provide information and guidance about managing the impact of fatigue on activities of daily living. The content is aimed at helping people with a palliative or long-term progressive condition to improve their quality of life, overall well-being and independence. This session may also help family members, carers or other healthcare professionals.
Here is an outline of what we will cover in this session. We will first provide some general background information about what fatigue is and how it can impact on your daily living. We will then explore some positive coping strategies that can be used to manage your energy levels and reduce the impact that fatigue can have on your daily living. We will also look at the importance of sleep, physical activity, and diet in managing your energy. The session will close with some information about where to go for more support and which healthcare professionals can help advise you further on the topics we have covered in this session. Before we start, it may be useful to get a pen and paper for you to make some notes. We have also scheduled a couple of opportunities for you to pause the video if you need a break away from your screen. Please pause the video now if you would like to go and get anything before we move on.
Fatigue is a term used to describe a feeling of extreme tiredness, exhaustion, or lacking in energy. Fatigue can impact people physically, cognitively, socially, and emotionally, and it is a common symptom that many people with a palliative or long-term progressive condition may experience. The severity of fatigue can vary from week to week or even day to day. For some people, fatigue can become increasingly worse over a period of weeks or months, whereas other people may experience a sudden loss in energy. Therefore, the variable and unpredictable nature of fatigue can make it very difficult to manage and plan any daily activities that you may need or want to do. Please remember that it is possible to make changes to the way that you do things and manage your energy levels better. We will talk you through some positive coping strategies later in this presentation. Fatigue can present itself in many different ways, but mostly affects people physically, cognitively, socially, and emotionally. You may feel as though you have no strength to do anything, and even the smallest of tasks can feel extremely difficult to complete. For example, making a cup of tea or picking up the post from the floor. You may also find that high energy activities such as getting washed and dressed can use up so much energy that you feel too exhausted to do anything else and need to sleep or rest for long periods after. Some people experience cognitive difficulties with their concentration, thinking, speaking or remembering things, or feeling dizzy or lightheaded or foggy. It may become increasingly difficult to stay awake or concentrate on your favourite TV programmes, reading materials or other hobbies. You may feel as though you don't have the energy to socialise with your loved ones, or that the whole process of going out and socialising quickly uses up a lot of your energy, so you feel exhausted the next day. Fatigue can also affect your mood, emotional regulation, and personal relationships. Some people may feel sad, frustrated, angry, or guilty about finding everyday activities much more difficult to do, or you now need help with. If any of these symptoms sound familiar to you, Perhaps write them down for you to discuss with your healthcare professional.
Let's take a look at some of the most common causes of fatigue. Some people with palliative conditions such as cancer, chronic heart failure, or a neurological disease may experience fatigue that is directly related to their condition. For example, the physical presence of cancer itself and the impact that cancer has on organs such as the heart and kidneys can affect how easily the body is able to function. You may hear this referred to as cancer-related fatigue or cancer fatigue. Whereas people with a neurological condition such as motor neurone disease may have increased muscle tone, which will often use up a lot of energy reserves, leaving the person feeling extremely fatigued. Treatments such as chemotherapy or radiotherapy can also damage other healthy cells in your body, which often causes side effects such as sickness, pain, insomnia, or anemia. Some fatigue is directly related to the body's recovery from surgery or immunotherapy, and some surgical procedures may impact a person's ability to absorb the energy released from nutrients in our food. People with palliative symptoms such as chronic pain or breathlessness may become less mobile, eat and sleep less, or experience psychological barriers such as low mood and anxiety. It is important to be able to manage your symptoms well enough to reduce their impact on your energy levels. It's always worth making a note of any activities that particularly exacerbate your symptoms. When seeing your palliative care healthcare team, it is always helpful for us to know if you have a particular goal in mind that you would like to aim towards achieving. You can find additional goal-setting materials in the Bite-sized Toolkit section of our website. Low mood, anxiety, or stress can also reduce energy levels and impact on your quality of sleep. Sometimes the act of thinking and worrying itself can also use up your energy. You may also have additional physical or psychological healthcare needs such as diabetes, high blood pressure, or depression. So the body's energy resources are having to fight against multiple levels of disease. Your body may need more nutrients than usual, so the body has enough physical energy to function as well as it can whilst fighting your condition. However, symptoms such as nausea and sickness can make it difficult to eat and drink. And fatigue itself can also reduce the energy you have to make nutritional meals and drinks. Treatments such as chemotherapy can also change someone's appetite and taste so they eat and drink less. Towards the end of someone's life, fatigue may become more prevalent and they may need to sleep more often. At this point, it is important to recognise that any specific interventions to reduce someone's fatigue may no longer be appropriate and may be distressing. Towards the end of someone's life, fatigue and increased sleepiness may offer protection and shielding from any suffering. Before we start looking at coping strategies to manage your energy, let's stop for a moment to reflect on how you feel right now. If you feel like you would need a break, please pause the video and perhaps make yourself a brew or stretch your legs before we move on.
Over the course of many years, most of us will generally develop a daily and weekly routine that can become so ingrained within our lives that it may be quite a shock when you start finding certain tasks becoming a little harder to complete, or they now drain your energy unlike before. It can also feel quite daunting to hear a healthcare professional suggesting you try a new way of doing something, using equipment, or adopting a different daily routine when you've always gone about your everyday living in the way you feel best. These feelings are completely natural, but we would encourage you to feel empowered by making these changes and view them as a positive coping strategy for you to maintain control in your life and continue doing what is important and meaningful to you. The key message of energy conservation in reducing the impact of fatigue is not to use up too much energy when you don't need to. When managing your energy levels across a day or week, it is often useful to consider the 3 Ps: plan, prioritise, pace, all of which we will cover in more detail on the following slides. Give yourself permission to say, "Not today," and be kind to yourself. Your body is adapting to a lot of change, and it is vital that you don't try to overstretch yourself, as this could cause more harm than good. It is perfectly okay to set new boundaries for yourself and your loved ones, or to leave less urgent tasks for another day. It is also perfectly okay to reach out for help with any tasks or chores that drain your energy, such as hoovering or gardening. Some people may choose to pay for a cleaner or gardener, or ask family members to help with the laundry. Asking for help may then free up enough energy for you to participate in the activities you would rather do, such as hobbies or being able to fully enjoy and engage in spending quality time with your family. If you would like further guidance on what financial support is available to you, please speak to our social work team here at St Catherine's.
In the previous slide, we mentioned the 3 Ps as a coping strategy to manage your fatigue: plan, prioritise, and pace. These techniques can help you to plan out your day and week so you can complete as many activities that you may want or need to do, all within your energy levels. In the first step of initial planning, it is always helpful to assess your energy levels so that you become more aware of your body's energy levels and needs. This can also help you to monitor how you feel at different times of the day and across the whole week. If you're unsure where to start, we would recommend that you keep a diary over a couple of weeks for you to see if there are any daily activities that make you feel particularly energized or drained, or whether you spot a pattern in which you have more or less energy. Some other useful questions to ask yourself may be: what does my mind and body need in the form of food, sleep, rest, or exercise? What are my limits? What activities are most or least important for me to do? It is always helpful to continue monitoring your energy levels for any change, so you can adapt as necessary or seek help from a healthcare professional if you feel like you need more support. If you do need more one-to-one support with managing your energy levels, you may be able to see an occupational therapist or physiotherapist, and we may choose to use a formal assessment to determine your level of fatigue and to develop a treatment plan with you based upon your individual goals. Here are just a few examples of some daily activities that many of us engage in each day. Perhaps take a moment to reflect on the areas that are most important to you and to consider where you want to prioritise your energy.
Once you obtain a better understanding of your body's energy levels and needs, it will be much easier for you to then prioritise your activities and plan your day or week ahead. Now, let's consider what you would like to spend your energy on and what activities do you need or want to do each day or week. What is most important to you? It can be helpful to imagine your energy resources as a phone battery, a jug of water, or pocket money, so you can prioritise more important activities to be completed when you have the most energy. Though we would recommend that you never use all your energy, especially on good days. It is always good practice to try and leave 20% in your energy reserve at all times, because you never know when something unexpected may crop up that needs to be done or demands more energy than usual. You could also consider asking someone to help or delegate tasks.
Pacing is a self-help technique that aims to balance energy expenditure with periods of rest. But first, let's take a quick look at a common approach that we often see being used to manage daily activity. Do you feel trapped between a pattern of having very good days followed by very bad days? Do you tend to make the most of your good days and do as much as possible? Do you find that travelling to healthcare appointments depletes your energy? And do you feel exhausted or in more pain than usual the next few days? If any of this sounds familiar to you, then you may be falling into a boom and bust pattern with your energy levels. Whilst it is tempting to overdo it on the days that you feel more energized and you feel like you need to make the most of this increased energy, overactivity can increase fatigue and pain, and it can take much longer to recover from a crash in energy levels. It is also quite easy to fall into a pattern of inactivity on the days you feel less well. However, underactivity can cause physical deconditioning in your muscles, joints, and ligaments, so the body tires much more quickly when it is active again. We would suggest that you try and avoid taking an all or nothing approach to your daily activity, as this is a counterproductive way of managing your energy levels. It is much better to try and keep a similar level activity each day so that your energy levels are more stable. Once you have a better understanding about your body's energy needs, you can use this information to make the most of your energy levels and plan out your day or week ahead. Here are some top tips for pacing yourself. Know your limits and try not to do too much on one day, and instead spread your activities out across the week. Allow yourself periods of rest in between your activities. Some people find it refreshing to sit down for 10 minutes with a cup of tea, whereas others may need a short nap in their chair or bed. We would not advise sleeping for longer than 1 hour during the day, as this may interfere with your overnight sleep. If you find yourself napping for longer periods of time, consider reassessing your activity levels. Try and leave 20% in your energy reserves at all times, as this may help you on other days where you feel less well or have less energy. Remember to be kind to yourself and know that it's perfectly okay to give yourself permission to say not today, or to have a rest, or to seek help from other people. If you are worried about your energy levels or your fatigue becomes too unmanageable, then please speak to your GP or healthcare professional. You could always ask to speak to them via telephone or a video call if your fatigue prevents you from physically attending any appointments.
Now that we have covered some basics in positive coping strategies for fatigue management, let's apply these principles to plan for an activity that you want or need to do. Getting into the habit of monitoring your energy levels, pain, breathlessness, and mood on a daily basis can be really useful for you to gauge whether today is a good day for certain activities. Consider whether the activity can wait until tomorrow or someone else can help you out. Before completing a task or activity, consider what items you will need and try to gather everything together so you don't have to go back and forth multiple times. Some people may need to take pain medication before certain activities, though we wouldn't encourage you to start taking medication without discussion with your medical team first. Sometimes people find that a piece of equipment can help reduce the physical energy spent on a particular task. For example, a kitchen trolley can help you to gather items and transport them between rooms all in one go. If you have already been prescribed some equipment from your occupational therapist, can you easily locate and use the equipment? Is there space for you to use the equipment safely and easily? Consider asking someone to help, or let them know you are trying to go about your daily activities a little differently to your usual routine. Please keep a lookout for the self-care series, where we will apply some of these strategies in more detail to specific areas of daily living, such as taking care of yourself and taking care of your home. We would not advise you use equipment or aids without guidance from an occupational therapist or physiotherapist. Please see the Equipment, Aids and Adaptations Guide for more information about what is available to help you use less energy and make daily activities easier. If you feel that you or a family member may benefit from using any equipment or aids and you would like to speak to someone, please speak to your doctor or palliative nurse specialist about referral to the most appropriate therapy team to meet your needs. Before we move on to the next section, let's take another moment to pause and reflect on how you feel right now. If you feel like you need a break, please pause the video and perhaps make yourself a brew or stretch your legs before we move on.
We've just covered 3 key positive coping strategies for managing your energy levels: plan, prioritise, and pacing. However, it can be hard to put all of this into practice if you're already waking up feeling exhausted. Sleep is an essential pillar of physical and psychological well-being, and most adults need 7 to 9 hours of good quality sleep to maintain their wellness. Sleep deprivation can cause increased fatigue, stress, anxiety, and a deterioration in mood, cognitive functioning, and performance. Here are a few top tips to make sure that you get a head start in managing your sleep and your energy. Aim to minimize your caffeine intake throughout the day and limit your alcohol intake. Eat a balanced and nutritious dinner before 7 p.m. each evening, and try not to make your evening meal too heavy. Physical exercise can also improve sleep quality, but we will cover physical activity in the next slide. Stick to a regular sleeping pattern so you wake up and go to bed at roughly the same time each day, including on the weekend. If you need to rest during the day, limit your afternoon naps to 1 hour so that your nighttime sleep is less affected. Switch off your digital screens, such as your TV and mobile phone, around 90 minutes before bed, so you can disconnect and relax your mind before you go to sleep. Does your sleeping environment feel calm and relaxing? Is your room temperature too hot or too cold? The ideal room temperature for sleep comfort is around 16 to 18 degrees Celsius. Is your room too light or too noisy? You could consider using an eye mask if your room is too bright, or for noisy rooms you could perhaps use a white noise application on your smartphone or wear some earplugs. If you're still awake around 20 minutes after going to bed, try getting up to have a warm drink or do a relaxation exercise such as deep breathing or meditation. If you're worrying about something, keep a notepad beside your bed and make a note of your problems to be tackled the next day. If you have tried all of these techniques and you still experience difficulty in getting to sleep, waking up frequently, or you wake up after a full night of sleep still feeling fatigued, we would recommend that you speak with your GP or healthcare professional. If you're carrying more than your recommended body weight and snore loudly, wake up with headaches, or feeling breathless, you may need to speak to a healthcare professional about a sleep apnea test, which happens when someone's breathing stops and starts again in their sleep. Towards the end of someone's life, fatigue may become more prevalent and they may need to sleep more often. In this case, fatigue and increased sleepiness may offer protection and shielding from any suffering.
Physical activity is a safe and important part of overall physical and psychological wellness for people with a palliative condition. Physical activity doesn't always need to be energetic forms of exercise such as running and cycling. It also includes lighter forms of movement such as walking to the postbox or gardening. Whilst physical activity isn't always possible for people experiencing fatigue and low energy, an appropriate level of activity can improve energy levels and reduce the impact that fatigue has on your activities of daily living. Keeping active can also boost your appetite and improve your mood and sleep quality, and prevent or slow down the effects of aging or disease on your physical ability, enabling greater independence with everyday tasks that are important to you. Whereas physical inactivity can weaken your muscles, increase stiffness in your joints, and reduce flexibility, balance, and coordination. This may mean that your body has to use more time and energy to complete everyday tasks. If you would like to increase your physical activity, we would suggest that you start off slowly and set small, achievable goals to begin with. Here are some suggestions to incorporate extra activity into your everyday living. Set an alarm to stand up every hour, walk to your front door and back again. Or when you're out and about, try walking instead of driving, or use the stairs instead of the lift. If you would like to build more structured physical activity or exercise into your day, try choosing something you enjoy, such as walking or gardening, and apply the 3 Ps to your chosen activity: plan, prioritise, and pace. If you still feel well enough with increased activity, try and increase your activity a little bit each time. For people who are less well, be kind to yourself and try not to push yourself too much. Try also not to hold too high expectations of yourself, as your body is going through a lot. Remember that even the smallest amount of physical movement and stretching is better than complete inactivity. But if you're feeling too tired to do anything at all, then listen to what your body is telling you. People approaching the final stage of their life will naturally become less mobile and sleep more. Sometimes people may not have the energy to eat, drink, or even speak. At this point, it is important not to expect too much of yourself and carefully consider how you would like to spend your energy. Please ask to speak to a medical or healthcare professional for advice before you start doing any physical activity or increase the amount you already do. Our physiotherapy team may be able to offer you specialist palliative advice about specific exercises or develop a personal treatment plan based upon your individual needs and diagnosis.
Eating and drinking well plays an important role in maintaining a healthy weight and managing your energy levels, thereby reducing the symptoms of fatigue. Think of your food and drink as fuel for your body. Consuming high quality, nutritious, and wholesome food will help your body function better and improve the way you feel, both physically and psychologically. Most people should try and eat a balanced diet that consists of fruit and vegetables, starchy carbohydrates such as pasta, bread, or potatoes, protein such as lean meat and fish, or eggs and beans, and some milk and dairy foods such as yogurt and cheese. Try and reduce the amount of processed food and red meat that you consume, which are often high in sugar, salt, and saturated fats. Your body also needs to stay hydrated with enough fluid to function properly. You should aim to drink around 2 litres of fluid each day, but you may need more if you are more active, sweating, or it's warm. The best fluid to drink is water, which has no calories or added sugar. Try and limit your caffeine intake, which can make you feel shaky or want to go to the toilet more. Also, alcohol, which can dehydrate you further and also alters your mood to a more depressive state. Some people may have difficulty being able to physically make meals and drinks due to problems with mobility, strength, or upper limb control. There are techniques and equipment available that an occupational therapist can speak to you about. Some people may also have difficulty in physically being able to eat, drink, or swallow. Your medical professional may suggest speaking to a speech and language therapist for advice on eating and drinking. Towards the end of life, the body starts to function much more slowly and will require less food and fluid intake, and this is a natural part of the dying process. It is at this point where food and fluid intake will not improve energy levels, as the disease has progressed too far for the body to continue living. At this point, it is important that the person is kept comfortable with hydrating mouth care such as ice chips, a sponge stick with their favourite drink, or a lip balm. Please speak to a medical or healthcare professional for advice before making any changes to your diet. You may need to speak to a dietitian for specialist nutritional advice.
Here is a quick guide to how each member of the multidisciplinary team may help you with some of the different topics we have covered today. If you feel that you would like to speak to any of these healthcare professionals, please speak with your doctor, specialist palliative nurse, or any other healthcare professional involved in your care.
If you feel that you or someone you care for is needing specialist one-to-one advice about energy conservation techniques and fatigue management, you may be interested to hear about our specialist clinic, which we can offer virtually or at St Catherine's Hospice based in Scarborough. Please see the next slide for contact details to find out more. We also have some bite-sized self-help resources which you can access in the Toolkit section of our website. These include a goal-setting worksheet, fatigue management scale, and diaries to record important details relating to your wellness. If you would like further information about any of the services available at St Catherine's Hospice, please visit our website at www.stcatharines.org.uk. If you feel that you or someone you care for is needing specialist advice, please contact us by telephone on 01723 351 421.
Please keep a lookout for the self-care series, which will provide basic practical information and guidance in managing everyday tasks that some people with a life-limiting condition may experience difficulty with. Our aim is to help people improve their quality of life, overall well-being and independence, and we hope that the self-care series will benefit those who may not require specialist input just yet, or who may be waiting for an assessment, either from ourselves or from another organisation.